Hello, I'm Dr. Ross Bertilson with A Plus Chiropractic, and I'm here to give you keys to a better life. First thing I want to talk about today is something in chiropractic we call a subluxation. When you come to a chiropractor, you're coming because you've got a sore back or you've got a problem other than your back, but the primary things that we work on in chiropractic is called a subluxation. Now this is a typical model of your low back, and the rest of your spine looks similar to this, okay? It's composed of the disc, which everybody hears about. You always hear about somebody getting a blown disc or a bad disc. The vertebrae, which is the bone, and your spinal cord and your spinal nerves. Now, the primary problem that people have with their back is called a subluxation. A subluxation is simply a joint that gets stuck and jammed and doesn't want to move properly. Normally, you have a small amount of movement with each segment of your spine. That allows your whole spine to move in the incredible ways in which we can move. This is a typical vertebrae in your spine. Now, one thing that I want you to notice, the disc. We all hear about the disc because people have blown discs or they have bad disc or something like that. The disc is made out of material that is like jello. Okay? The center of the disc is actually like liquid jello that you have in your mouth. It's almost that fluid. As you go out to the outer side of the disc, this outside of the disc is stronger than steel strap, but very flexible. Now, what happens when somebody gets a blown disc is you get some kind of an impact on that disc. And when that happens, that center will actually leak out to the side. When it leaks out to the side, it actually starts to affect the nerves. Anytime you get something touching a nerve, it's extremely painful. Now, your disc normally has a small amount of motion, but when you can combine that over your whole spine, your whole body has an incredible amount of motion. It's all supported by your spine. What happens when you get what we call a subluxation is one of those joints will lock. Now, that's really important to the health of your disc because normally with the motion, you're pumping fluids in, pumping fluids out, you're pumping nutrition in, and you're pumping wastes out. Okay? Now, you lock that down, and all you're doing is pumping out, pumping out, pumping out. You're getting nothing into that disc, and pretty soon it begins to degenerate. Now, this is an example of what can happen when your disc is degenerated. Notice the difference. Big, fat, fluffy disc. Almost no disc because all of the fluid and all of the liquid has been leaked out. Okay? This disc has been damaged. It's bulging here. It's pressing on the nerve. You can see the difference in the nerve. The nerve will actually degenerate. In other words, get smaller and not be able to carry as much nerve flow as a healthy disc, as a healthy nerve. Now, normal motion, abnormal motion. You lose motion in the disc. You also, as you degenerate, you create what are called bone spurs. The bone spurs can actually pinch on the nerve itself and they can irritate the disc itself. Now if you look at this one next to the healthy disc, you can see that the center has busted through, has broken through the edges and is actually oozing out. This is what's called a blown disc. A bulging disc would be if we just put an incredible amount of pressure on this and cause it to bulge out. Both will affect your nerves. You can see the need for a healthy spine because you have to have motion in your spine in order to be healthy. Everything in your body is controlled by your brain through your spinal cord, out your spinal nerves. If you've got a subluxation, If you've got damage to one of your discs, what it's doing is cutting off the nerve flow to that area of your body. Now this isn't just muscles. You know, when we think about a backache and stuff like that, we think about the pain in the muscles. This is also affecting all of your organs and body systems. So it's not just your muscles that are being affected. Very, very important, because a lot of times when people have different disease processes like heart problems, lung problems, even babies with colic, we find a subluxation in the back that is associated with those areas of the spine. This is a picture of everything in your body, basically all of your organs that are controlled by your brain. Your brain controls all of those through the spinal cord, out the spinal nerves. You can see that your lower back controls your colon. Your middle back controls your stomach. Your upper back and as you're going into the neck, controls your heart and your lungs. Your neck controls a lot of the stuff that happens in your face and in your head. Okay, this is important with babies, because when a baby is born, a lot of times we'll find a subluxation, a bone out of place in the spine, right in this area. This controls the esophagus, which is right at the top of the stomach. That's why babies throw up a lot of times. When we correct this by an adjustment, by a chiropractic adjustment, the colic goes away, because then suddenly the brain can talk to the stomach can talk to the brain. We've also seen people with lung problems, and we find subluxations in their upper back, so the brain is not able to talk to the lungs are not able to talk to the brain. We repair that subluxation, we fix that with a chiropractic adjustment, and suddenly the lungs start working better. This is absolutely key in chiropractic, because a lot of times people come in with back pain and they'll go out with other symptoms gone, which is absolutely cool. This picture represents the phases of degeneration. Again, this is one of the primary things that we are working on in chiropractic. You can see over here, you have a healthy spine. Now, when you have an injury, you step into phase 1, where you begin to have inflammation, you begin to have problems with the disc, it might lock up. Okay? If that's allowed to remain that way and not corrected and not gotten to move again, it will continue to phase 2 and phase 3. Once you get past phase 2 into phase 3, there's very little that can be done, even surgically. Phase 3 going to phase 4 is the point where your spine is actually completely locked up and you're not moving in that area at all, and you're not going to move. Our goal in chiropractic is to keep you in phase 1 or phase 2, and then to bring whatever phase you might be at, stabilize it, keep it from getting worse, or possibly bring you from phase 2 back to phase 1. The goal in chiropractic is to keep your spine moving and your spine healthy so that it doesn't continue to degenerate. This is Dr. Ross Bertilson with A+ Chiropractic, and this has been your Keys to a Better Life today. Thank you, and have a wonderful day. We look forward to seeing you.